Hi there, this is Estíbaliz Maudes, and in this video I will be discussing our publication, Neuro-immunobiology and Treatment Assessment in a Mouse Model of Anti-NMDAR Encephalitis, directed by Professor Josep Dalmau. Anti-NMDA receptor encephalitis is an antibody-mediated encephalitis associated with antibodies against NMDAR. The pathogenicity of these antibodies has been demonstrated in vitro and in vivo, and the evidence shows that these antibodies bind, cross-link the receptors, and cause their internalization. As a result, there is a decrease in NMDAR surface density and synaptic plasticity impairment. The clinical presentation of anti-NMDAR encephalitis starts with a viral-like prodrome, followed by prominent psychiatric symptoms, such as mania and agitation. These symptoms are rapidly followed by neurologic complications, such as seizures, abnormal movements, and decreased level of consciousness. Often, patients need to be admitted in the intensive care unit. The primary treatment strategy for patients is immunotherapy, in particular anti-CD20 B-cell depleting monoclonal antibodies. Most patients respond to immunotherapy. However, the recovery process is dominated by residual cognitive symptoms that can persist for several months or even years. This chronic stage of the disease is yet not completely understood. It is also unclear what is the best treatment strategy. The classical animal model of cerebroventricular infusion of patients' antibodies was very useful to characterize patients' antibody pathogenicity and to test a new treatment strategy. However, a new model developed by active immunization is needed, which will allow for an extended characterization over time, where mice have inflammatory involvement producing their own mutant NMDAR antibodies, and therefore this model will be a suitable platform to compare new treatments to immunotherapy. With this aim, we immunized 8-week-old female mice with a gluon-1 peptide, AddaVax, and pertussis toxin. Some mice were treated with anti-CD20 and/or SAGE-301, a positive allosteric modulator of the NMDA receptor or PAM. Mice followed an intensive battery of behavioral tests to evaluate memory, psychotic-like behavior, anxiety, and depression. Tissue studies were conducted on 2 different time points to assess acute and long-term effects of the model and treatments. A subset of animals was also assessed for seizure development using intracerebral recordings. Gluon-1 antibodies were found in the serum and CSF of NMDAR mice by 3 different techniques: cell-based assay, cultures of live neurons, and rat-brain tissue immunohistochemistry. In the brain, we could find B-cell infiltration in NMDAR mice on days 42 and 71, including memory B cells and plasma cells. Treatment with anti-CD20 depleted B cells. However, memory B cells started to repopulate the brain on day 71. We were interested in exploring whether these antibodies had any molecular effects, and by confocal microscopy we could demonstrate that NMDAR mice have a significant decrease of total and synaptic NMDAR density in the hippocampus and cortex. The allosteric modulator recovered NMDAR density in all areas. Anti-CD20 was effective on day 42, but on day 71, mice treated with anti-CD20 showed decrease of NMDAR density again. We noticed that untreated NMDAR mice had increased microglial activation on day 71. Moreover, we could demonstrate by confocal microscopy and super-resolution images that microglia phagocytates IgG bound to NMDAR. Finally, we assessed the behavior of the model, and we demonstrated that NMDAR mice show psychotic-like behavior in the acute phase of the model and depressive-like behavior during the chronic stage of the model. This resembles the clinical presentation of patients. In this slide, we show that NMDAR mice also present with memory impairment. Treatment with anti-CD20 temporarily recovers this, but treatment with the allosteric modulator or the combination of both treatments is effective in recovering memory long-term. Additionally, immunized mice, but not controls, developed a decreased threshold for all types of seizures, including jerks and tonic-clonic seizures, which were demonstrated with intracerebral electrodes. and a subset of NMDAR mice developed stereotyped abnormal movements. As a conclusion, in this publication we present a novel and comprehensive mouse model of NMDAR encephalitis by active immunization. This model reproduces all of the neurobiological paradigms known up to date, including the reduction of NMDAR density and the impaired hippocampal plasticity. Moreover, it shows a clear B-cell implication with B-cell and plasma cell brain infiltration, a polyclonal response, and antibody production in deep cervical lymph nodes. Finally, mice show multiple symptoms of NMDAR encephalitis. This model has allowed for a prolonged follow-up and has been validated by anti-CD20 immunotherapy. It has also allowed the testing of a new treatment strategy, and results have shown that the NMDAR PAM stage 301 could be an effective adjuvant treatment to immunotherapy during the prolonged recovery period of the disease. Thank you for your interest on our manuscript, and please do not hesitate to contact us to discuss further.